It's absolutely crazy to me. And I'm going to try and do this in 3 minutes. Sunday morning, I woke up with an insane rash on my forehead and chest. I thought, okay, if this doesn't go away by tomorrow, I'm going to go to urgent care. I go to urgent care the very next day. They say, oh, that's MRSA. I said, okay, well, can we test it to make sure? They said, oh, yeah, if you want. They take a culture. They say it'll take 3 days to come back, give me an antibiotic, but tell me to see my PCP immediately. So I see my PCP immediately. She says, oh, it's a rash. Gives me an antibiotic. So in my mind, I know that it's not just a rash. I can tell that something's wrong. So I call urgent care, and I'm just like, hey, is there any way you can test that for monkeypox? They said, monkeypox? I said, yeah, that disease that's going around? They said, yeah, we don't do that. So I get a third opinion, see another PCP. I go in, she says, let me go get my colleague. So now I have 2 doctors staring at me. They both say, I have no idea what this is. You can go back to work. So I'm driving home, tell my boss I can come back to work. They call me 45 minutes later. Said, do not go anywhere. We think this is monkeypox. Please go see this dermatologist tomorrow. So I make an appointment with that dermatologist. Let me also just mention, at the appointment, I mentioned, hey, do you think this is monkeypox? And they said, what's monkeypox? So Thursday comes around, the day of my dermatology appointment. The doctor calls me and says, we're canceling your appointment. We're not dealing with that. And I quote, call the CDC, is what they told me. I call the CDC. The CDC says, call your PCP. The lady I talked to at the CDC had no idea what she was talking about. Couldn't answer any of my questions. I have not been able to get tested anywhere. Doctors have refused to see me. And I have this mysterious and painful rash all over my face, chest, arms, back. And meanwhile, 3 doctors had no idea what I was talking about when I said, is this monkeypox? So if you're wondering how COVID got spread around so easily, for 2 years we were locked down and millions of people died, it's because the CDC has no idea what they're doing. Nobody's educated, not even doctors. And doctors will refuse to see.
Alright guys, so the next pandemic is officially here. The next reason that the government is going to use for an authoritarian lockdown or takeover or stripping of our civil liberties and rights, as the World Health Organization has declared monkeypox a global health emergency.
So in short, we have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Yeah, so basically here we go again. And my question about this being a public health concern, okay, for the international community is specifically who, right? What demographic, what groups of people is this really a concern for, okay? Because it seems to me that they're trying to upset all of society, right? Or alert all of society about a disease that seems to be affecting mainly a certain group of people, okay? Specifically in the US, in Europe, and in Western countries. But you can't really say that, right? Because if you do that and you say, hey, you know what, this is an epidemic among a certain group of people, you might be deemed a homophobe. And I think that that's what's going on here, right? I really do. I think this is wokeness gone astray, because I got a feeling that now that this disease has been declared a global health emergency, we have to now start having real conversations about who this disease is affecting, and all of a sudden facts are going to become homophobic, okay? I just wanted to prepare you guys for what I think is going to happen, okay? But I guess the larger, more important question is this government declared emergency gonna be the one that takes us back into pandemic lockdown mode 2.0, right? Basically what we experienced during COVID. I don't know. It seems like they're throwing darts at the wall and they're trying to see what sticks, because just a few days ago, it was climate change, right? Climate change was the emergency that we needed to mobilize against, right? Immediately, right now, okay? Now it seems to be monkeypox, right? So let's read about this, because I think that, again, the conversation about this disease is about to get very, very, very divisive, okay? And I got a prediction about what I think is going to happen here. But let's read here. The World Health Organization has declared that monkeypox is a public health emergency of international concern as global case numbers surpass 16,000. This is the first time the WHO has declared a global health emergency since the start of the COVID-19 pandemic in January 2020. The WHO's Director General, Dr. Tedros, I'm not pronouncing the rest of his name, said the emergency committee believes the risk is moderate globally except in the European region where they assess the risk as high. Monkeypox, rarely detected outside Africa before now, has in recent weeks spread to thousands of people across dozens of countries, mainly among men who have sex with men. No deaths have been reported among the cases outside of Africa, but 5 people have died in Africa since the start of the year. Epidemiologists say the virus, which requires close contact to spread, is likely exploiting close-knit social and sexual networks among men who have sex with men. Okay, so just reading this, right, and these are facts, okay, YouTube moderators, these are facts, okay, not hate speech. It seems like this is spreading at least closely or similarly to an STD. However, they haven't declared it to be an STD yet. Okay, because if they declare it to be an STD, specifically an STD that affects a certain population of people, then it becomes harder to justify what I think is going to come in the future, right? Which is the government saying that, look, everybody needs to get vaccinated for this, right? Even though it really is affecting a certain population of people the most. Not saying that it can't affect straight folks. Seems like you can get it. However, I mean, again, the numbers overwhelmingly suggest that it's affecting a certain population of people. But despite that, I think they're going to use that as a way to justify saying, hey, everybody needs to get vaccinated for this, okay? Everybody needs to get vaccinated. And I believe that when that conversation happens, it's going to get very divisive because a lot of people are going to simply state facts and they're going to be deemed as homophobic for stating facts about, hey, this is why I probably don't need to get vaccinated for this, okay? But, you know, hey, we'll see, right? We'll see. I just think that that's the direction this is going to go in. So the main purpose of the WHO declaring this a public health emergency is to, quote, mobilize resources to contain the transmission of monkeypox, according to global health experts. Now, what does that mean, right? The key is, what does that mean? Because for COVID, that meant lockdowns, social distancing, masks, vaccines. What does that mean for monkeypox, right? That's the real question that has to be answered here, okay? This disease does have some vaccines that they use to try to treat it. However, the supplies have been constrained and they're not really that available, okay? And they've tried to focus their vaccination efforts on men who have sex with men. However, I think that what is happening here is that when you declare a public health emergency, a global public health emergency, what happens is that creates a market opportunity for big pharma, right? Where they, you know, their ears perk up and they say, oh, it's an emergency that everybody should be aware of, that everybody should mobilize against, which means that everybody needs to follow the protocol, right? Here we go. We have vaccines that aren't readily available, okay? We need more supplies. Sounds like a market opportunity for big pharma, right? Sounds like a way to get some money. Now, you know, so far, there are 2,800 cases in the United States. And Democrats are basically calling for Biden to declare a public health emergency, okay? And they haven't decided whether or not they're actually going to do that. But there's an interesting story here that really kind of blew my mind, okay? That I think really is a cause for concern here, right? As the CDC has confirmed the first U.S. case of monkeypox in children. Now, I'm going to read this, guys, from Axios, and this is going to blow your mind, okay? This is going to raise a whole lot of questions, okay? You guys tell me what you think about this. Quote, the U.S. has confirmed the first 2 cases of monkeypox in children. Centers for Disease Control, Prevention, and Control Director Rochelle Walensky said Friday. The CDC has said children, especially those under 8 years old, are among those at especially increased risk for severe monkeypox disease. Now, keep in mind, there's been 16,000 cases globally and only 5 people have died, mainly in Africa, right? Everybody else seems to, you know, they get it and they're okay. However, it seems like children who get this are at increased risk, right? Allegedly. Now, how has this virus been spreading in the U.S. and Western countries? Mainly through a specific demographic, right? So again, a child getting this disease in the U.S. Raises a whole lot of questions. So let's read here. Both of those children are traced back to individuals who come from the men who have sex with men community, the gay men's community, Walensky said at a virtual event with the Washington Post on Friday. Wow. Walensky better be quite careful. Stating those facts might be homophobic. Okay? But that raises a very, very, very disturbing question, guys. How in the world did children get monkeypox if the individuals that they traced it back to are gay men? Now, again, are children more susceptible to getting monkeypox if they interact with gay men? Or is something else going on here, right? Closer contact than just casual contact, right? Because to me, common sense would suggest that the only way it could spread mainly among men who have sex with men or the gay community is if the contact, the mechanism of spreading, it has to be very close, right? Intimate, okay? It ain't just something where you just, give a hug or you pat somebody on the head or, you touch a shoulder or whatever, because if that was the case, you would think that, it would be spreading more among other demographics of people, because it's not like gay men only interact with just gay men. They interact with straight men, straight women, family members, like all types of other people. So again, I got questions about how this spread to these kids, right? The CDC should be asking, how did this spread to these kids? The law enforcement agency should probably be asking how did it spread to these kids. But who knows? It could be one of those things where it just was, I don't know, luck, right? Or, there's something else going on here that we really don't know, right? So she says that both children are doing well. In a statement, the CDC said the cases are unrelated to one another and that both are likely the result of household transmission. Now, what does that mean? What does household transmission mean? Again, does it mean just, a touch on the head or, a hug or, food or sharing, a glass to drink or whatever? Who knows? Maybe that could be it, right? Maybe that's how they got it. I'm not sure. Men who have sex with other men remain the most vulnerable to monkeypox, but in some countries that saw outbreaks before 2022, young children died at higher rates from the disease, according to the World Health Organization. Sexual contact is not the only way the disease can be spread. Epidemiologists have warned that the risk isn't limited to any one community and that somebody who is not gay can get it just as easily as somebody who is gay. Now, I don't know, man. I feel like that statement, again, I got questions. I had questions because when 98% of the people that are getting this belong to a certain demographic and 1/3 of those people are known to have went to what they call sex on site venues, right, before getting the disease, that suggests that, I don't know. Again, I have some questions about this statement. But again, this is what I'm talking about, guys, in regards to the language around this disease. What's going to happen is that they're going to start saying stuff because we don't want to hurt a certain group of people's feelings, right? They're not going to stick to the facts and the science on this. And I believe that public health and our policy is going to be dictated by wokeness and not hurting feelings more so than facts. And that's going to cause some problems, right? That's going to cause some serious problems and a whole lot of divisiveness in this country if monkeypox continues to spread the way it is currently spreading, to the point where, again, the government now feels like they need to mobilize and to make everybody basically capitulate to trying to stop the spread, okay? See, I can already see this becoming a train wreck. Let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.